The following video will evaluate the safety, biocompatibility, and limitations of patient use of neuroprosthetics. Polymer encapsulations can absorb bodily fluids, but is this too harsh on patients? Well, it's not sure, but so far there have been no complications. Mechanically speaking, they are designed just like non-neuroprosthetics. This means that they must be biocompatible, because all non-neuroprosthetics are known to be biocompatible so far. According to scientists, electrodes used in neuroprosthetics rarely result in bodily rejection. It is considered an extremely rare occurrence. This means that the electrodes are relatively biocompatible. Overall, neuroprosthetics seem to be reasonably biocompatible because they are mechanically designed like non-neuroprosthetics. The polymer encapsulations have not shown absorbance of bodily fluids, and electrodes rarely cause bodily rejection. Sensibilities are often fixable with neuroprosthetics. For example, the cochlear implant, used to help patients who cannot hear well or cannot hear at all, has no known complications with any patients so far. For patients with severe nerve damage or brain damage, neuroprosthetics are often not a solution. For example, in a case study on stroke patients, the patients grew quickly fatigued when trying to grasp objects. They were not capable of understanding how to make the objects move the way they needed to because they either had no nerves in order to make them move or they didn't have enough proper brain transmissions to make it work. Paralysis patients can use neuroprosthetics depending on the severity of their cases. The programming required used to configure neurotransmissions is more extensive in these patients, so it's harder to develop the proper software needed for the neuroprosthetics. But if the case is not that severe, the programming will not be as extensive as it could be, and it might be manageable. Overall, many patients can use neuroprosthetics to solve their disabilities. It just really depends on their disability specifically and how severe their disability tends to be. Wire breakage and corrosion can occur after the neuroprosthetic has been in the body for an extended period of time. However, a special coating on the wires prevents this and makes them safer for human use and reduces the risk of corrosion. Single blocking capacitors in neuroprosthetics tend to not divide the currents adequately. Too much current goes to one side, resulting in not enough currents on the other side, so then the neuroprosthetic cannot function properly. More experimentation with other capacitors is needed with these to ensure the safety for human use. The procedure to implant neuroprosthetics is often very invasive, but according to scientists, they rarely have many complications at all. This makes the procedure very safe. Overall, neuroprosthetics are relatively safe devices aside from single blocking capacitors causing issues. Wire breakage won't happen because of the special coating on them, and the procedure to implant the neuroprosthetics doesn't usually have complications. Overall, neuroprosthetics are very biocompatible, do not have many limitations for patient use, and are relatively safe.